Hello, my name is Robert Panton. I'm an ophthalmologist from suburban Chicago, and I have the privilege of serving as the next president of the Illinois State Medical Society. I appreciate the opportunity to represent the physicians and patients in the state of Illinois. I'm addressing you today from a COVID-compliant environment, which really means our home. My immediate family is here with me, including my wife, Marika, our son, Jonathan, from the Illinois Wesleyan College, our second son, James, who's a freshman at Oak Park and River Forest High School, and Zoe, who is at Roosevelt Middle School. We had all hoped to meet you in historic Springfield, where our society was actually founded 180 years ago. Interestingly, I had intended to speak about the long history of service of the Illinois State Medical Society, including during pandemics. In the late 1800s, the ISMS encouraged the creation of the Illinois Department of Public Health, a department which is charged with setting sanitation standards to prevent future epidemics. One former ISMS president also served his community in a unique way. During the Civil War, Dr. David Prince was a Union officer who voluntarily stayed with captured Union soldiers in a Confederate prison. It is fair to say that Dr. Prince set a very high standard for the rest of us to follow. But in some sense, history is repeating itself. Governor Pritzker recently asked for retired healthcare professionals, including physicians, to return to the workforce to help fight coronavirus. On the first day, there were 180 volunteers. ISMS has been leading the charge to help physicians and patients during the coronavirus crisis. ISMS encouraged the governor to sign an executive order allowing for civil liability protections for healthcare workers. Another executive order loosened some of the restrictions on telemedicine. ISMS is also an important resource for physicians to access government support during the economic slowdown. In some respects, being the spokesman is not an ideal time during these types of change. In medical school, we were told that half of what we learn will become obsolete within 5 years. The key is to figure out which half. In the age of coronavirus, information obsolescence is closer to 5 days. Thankfully, the ISMS website is updated daily to assure the most recent data is included. But as an organization, we must look beyond the coronavirus crisis, even if the public does not. After the current crisis subsides, the main legislative priority for ISMS is prior authorization reform. Virtually every physician in the state has had difficulties in obtaining needed tests, pharmaceuticals, or procedures. According to an ISMS survey, over 90% of physicians have related delays in necessary care. The ISMS proposal would put some needed transparency into the entire system. On a personal note, I would like to thank you again for the opportunity to represent Illinois physicians and patients. I would like to stay connected, and I encourage you to log on to the ISMS website. I would also like to meet as many of you as possible in your hometowns, but my daughter Zoe wishes to clarify that that particular promise does not include softball season. Stay safe and see you soon.